Today we have Dr. Pamela Dragos, who has a bunch of letters after her name. She is a integrated veterinarian. She is a chiropractor for animals. She is the president of the American Veterinarian Botanical Society. Did I get that right?
American College of Veterinary Botanical Medicine.
Which they're having a online virtual summit in November that anybody can go to. So make sure that you join that. They're actually having human herbalists that are the guests for that 2 days, 2 day event.
November 9th and 10th, online.
And Dr. Dragos has this passion for fungus, a special fungus called Coccidioides immitis. I want to shake the hand of the guy who named that fungi because must be a fun guy. Because it's just fun to say. So thank you for being with us today. Let me make sure I press record. It's on Facebook too. And Dr. Pamela, take it away. If you guys are in the membership, hop on and join us on Zoom if you want. And if you're not in the membership, you can watch the live stream.
There we go. Thank you, Poppy. Let me try to share my screen. Let's see. You see my valley fever little puppy dog?
Yes.
All right, cool. So thank you, Poppy, for inviting me. And thank you, everyone, for listening, because valley fever is not very well known, and that's been one of the problems. And we're going to talk about valley fever, and I'll also talk about some cases, some really interesting cases. But valley fever is an emerging orphan disease. And a little bit more about me with what I do is I've been a veterinarian for over 30 years, and I practiced conventional veterinary medicine for decades, but now my focus is mostly holistic. And I address chronic diseases like valley fever holistically and conventionally. So I just want to make that clear. I treat it integratively, meaning I use conventional pharmaceuticals and holistic strategies, because valley fever really is not a disease to mess around with. So my mission is to bring awareness to valley fever.
Now, Dr. Pamela, this is not just a dog disease.
It's dogs and people and all mammals.
So horses can get it too.
Horses too, yeah. So what the heck is valley fever? So you alluded to it, Poppy. It's a fungal infection, and it's a really serious fungal infection. And it affects all mammals. And it's fun to say. It's called coccidioidomycosis, or cocci for short. And you don't want to confuse that with coccidia, which is that intestinal parasite. So that can get confused sometimes. Early infections of valley fever cause flu-like symptoms in people and pets. So things like coughing, fever, lack of appetite, lethargy, weight loss. And it's endemic to the Southwest United States, Mexico, and South America. But it's headed east, and we'll talk about that. It was first described in California as San Joaquin Valley fever in the San Joaquin Valley. And this was more than a century ago. And it's really just persisted in Arizona and California until recently.
Yeah, and I lived in the San Joaquin Valley.
Mm-hmm. Yeah. So
you guys, I got valley fever.
Yeah, me too, twice. You're not immune for life. They tell you you are, but you're not. So I've got lots of juicy information in my Canine Valley Fever Guide. So if you're interested in more information, it's a good introduction, and it's got some good resources in here. So what is an orphan disease? So why is valley fever an orphan disease? So let's go over the definition of that. It's kind of interesting. An orphan disease is a rare disease that affects fewer than 200,000 people in the country. And it's serious, they're life-threatening, they're difficult to diagnose and difficult to treat. And this basically describes valley fever. The other part of the definition that's really interesting is Big Pharma considers orphan diseases unprofitable to treat because of their high drug development costs and limited patient population. Really sad. So valley fever remains serious, life-threatening, difficult to treat, difficult to diagnose because people, including physicians and veterinarians, are just not educated about it or even aware of it. Scary stuff. So let's quickly run through some valley fever stats, and I'm going to run through the people stats because they don't really have a lot of the dog stats yet. But suffice it to say, more dogs get it than people.
That's amazing. That makes sense because they're on the ground.
Yep, sure does. So for decades, valley fever was confined to the Southwest, primarily Arizona and California, but now it's spreading north and east across the United States. So we have cases reported in New Mexico, Texas, Nevada, Utah, Washington State, and Oregon. Nuts.
So how is it traveling? Just airborne?
Yes, and it's mostly because of climate change. So it's airborne, but it's because the world is warming, it can support fungal growth. So when climate change happens, the fungus can stay and grow in more places. Yeah, and they said, and researchers are predicting that it's going to spread across the entire Western United States by the year 2095. Crazy.
Crazy.
Yeah, and cases are going to double. Oops, went the wrong way. All right. So infection rates in California right now are increasing, and rates have risen 800% since the year 2000. Crazy. The CDC estimates that there are about 150,000 human valley fever cases in the US annually, but researchers are saying that the number is closer to 350,000. And this is because it's underreported. So either people are not getting help, or the doctors are not reporting it to the CDC, or it's never been actually diagnosed in someone. Or it's been misdiagnosed, which is actually pretty common. Fun fact, I contracted valley fever pneumonia in Phoenix, Arizona, when I was at Arizona State University in 1982. And I was misdiagnosed in the ER as bacterial pneumonia and not treated appropriately.
Well, valley fever seems to be off everyone's radar.
Yeah, it's just not on it. People just don't know about it. And 200 people die every year from it. So it can be a fatal infection, and more dogs die than that. Arizona accounts for 2/3 of the 150,000 people infected with valley fever each year. And the caveat here is that we're a mobile society. So if you visit or just travel through a valley fever endemic area like Arizona or California, you can unknowingly get exposed to valley fever fungal spores. And when you go home, like to New York, for example, and you break with symptoms when you get home, because you don't get symptoms right away when you inhale the spores, then the medical professionals in the East don't even know about it. They don't know to test for it. They don't know to look for it. So they're really clueless, and they're just not diagnosing it. Happens a lot. So how do we and our pets get infected? Woohoo. Here's our valley fever circle of life. Crazy stuff. Okay, so the valley fever fungus, it's a fungal infection, grows as these little mycelium in the soil, and they multiply or grow bigger during the rainy season. And then when the soil dries, the fungal spores disarticulate or are released into the air, and they can either go back into the ground and make more little mycelium, or they're out here in the air and they get inhaled by dogs, people, any mammal. And then after inhalation, there's an incubation period of 7 to 21 days. So that's why you can get exposed, go back home, and then 3 weeks later, all of a sudden you get a fever and a cough, and nobody knows why. So in the lungs, these little spores enlarge, and then they morph into little or big spherules, which are kind of like a yeast-like organism, and they contain these endospores, and they get so big in the lungs that they burst and release all their endospores, and this just perpetuates the infection throughout the lung. So
now, if somebody with valley fever breathes on you, can you catch it? Is it contagious?
No,
Okay.
it's not contagious that way.
Then go to the brain.
There is one way that it is, but that's not one of the ways, and it's not very contagious. It's considered non-contagious in the literature.
Can it go to the brain?
Absolutely.
That's
Causes seizures, vestibular disease. Yeah. All right. So let's look at an x-ray. We'll look at a few x-rays today. So if the immune system fails and doesn't destroy that valley fever fungus in the lungs, then you get a fungal pneumonia. And this is a dog x-ray. Yeah. And I don't know if you're used to looking at x-rays, but this is a dog's chest on their side. The head would be off to the left, he's looking to the left. We've got the spine here, and you can see the ribs coming down. You can see the scapula there. The lung is the black part. Diaphragm is right here. And then this white in the middle is a fungal pneumonia. So this is the trachea coming down, this black tube. And we usually see valley fever as the trachea ends and bifurcates into the two bronchi of the lung. So you commonly get a pneumonia right at the hilus here and in a lobe nearby. So that's a fungal pneumonia. And then if it's not handled at this point, it can spread, like you said, to the brain, the heart, the bones, the joints, any organ. It literally goes to any organ. It doesn't follow any rules. So when I got valley fever the second time last year in October, I got a fungal pneumonia and got treated, but it spread to my knee and caused a septic arthritis. That was lovely. All right, so what about our pets? Since this is a pet, our holistic pet site. So every year about 60,000 dogs in Arizona alone get valley fever. And the University of Arizona Valley Fever Center for Excellence recently completed a study called the Incidence and Risk Factors Study. And it was based on pet owner or pet guardian survey results. So it actually has some interesting results that don't jive with what we've thought. So they found that about 6 to 10% of dogs in some Maricopa counties in Arizona become sick with valley fever every year. And the risk of infection was 5 times greater in dogs that spent more than 80% of their time outdoors compared to indoor doggies. And then dogs with more than an acre of land to roam had a risk of infection over 6 times greater than dogs in a smaller roaming area. So that was interesting, but this is even more interesting. So dogs that were raised from birth in Arizona had a 28% chance of getting infected with valley fever by 2 years of age. So one in 3 dogs get valley fever by 2 years of age here. And during that time, the chance of becoming really ill was 6%. And then overall in the US, they estimated 4% of dogs will be sick from valley fever every year. So you guys need to know about this because it can be sneaky. It can sneak up on you. This is the interesting thing about their study. So they didn't find any relationship between breed of dog, age of the home, and yard cover. So whether it was grass or gravel or desert landscaping, nothing. And they didn't find any relationship between digging behavior and whether they lived near construction sites, which really flies in the face of what we've thought, because we thought that dogs dig a lot in the dirt, so they're exposed to the spores more, so that's why they get it more, and they're, you know, closer to the ground and all that. And this study did not support that. And granted, it's only one study, but that was interesting. So I guess this can let pet lovers not worry about letting their dogs dig, because there are a lot of people that worry about their dogs digging in Arizona because they think it's going to increase the risk, but this study said it doesn't. And then proximity to construction sites. So anything that disrupts the soil, construction, excavation, dust storms, earthquakes, anything that disrupts the soil will get those spores airborne. But they did not find that construction sites increased the risk in dogs or living near construction sites. So that was another interesting thing. All right, so what do we do now? So what if you have a dog that gets valley fever, or you're helping someone with a dog with valley fever? What the heck do you do now? So I figured out a comprehensive system to turn around valley fever. And there basically are 3 core areas that we need to work on to help dogs get relief from their symptoms, like lethargy, lack of appetite, pain. And the first thing that we need to do is we need to educate pet lovers, the general public, the medical community. We need to bring awareness to valley fever because there's a big gap there. And then we need to equip pet parents with tools to help their dog recover from valley fever. And then once they have the tools, we need to empower them to use those tools and put an action plan into motion. So let's focus on, since we have limited time, valley fever awareness and building a foundation by learning more and knowing what valley fever looks like and how it's diagnosed, because valley fever can be a mystery illness. It's a great pretender. A lot of times it doesn't get diagnosed, it gets misdiagnosed, or it gets diagnosed too late. And by that time, it's way worse and takes longer for the pet to recover, if they recover at all. And really, many vets don't have a firm understanding of what valley fever is and what to look for, especially in those non-endemic areas. They may have never heard of it. So the more I can bring awareness of valley fever to this pet-loving community, the better chance we have of every pet getting a prompt, accurate diagnosis, which will increase their chance of recovery, which is what we want. So let's go over some of the symptoms. So our early symptoms of valley fever are flu-like symptoms, and that's one of the reasons it's misdiagnosed because the symptoms are very general, they're very vague. And these same symptoms are the ones that we see in people too. So fatigue, coughing, fever, muscle aches, joint pain, lack of appetite, just real general symptoms. It could be anything. And that's one of the problems. It could be anything. And then if it's not caught with those early signs and goes to the chronic symptoms of valley fever and spreads throughout the body, it's called disseminated valley fever. And so if it goes to, let's see, the joints, we get lameness and limping, or the bones too. So we can get swelling of the limbs or bone swellings. That's actually very common. If it goes to the kidneys, we'll see a glomerulonephritis, which is an inflammation of the kidneys. If it heads over to the liver, we get liver disease and elevated liver enzymes, which is always, confusing things for veterinarians, because you'll see liver enzymes elevated all the time and they don't know why. And I've had cases of valley fever where that was the only thing wrong on the lab work. That was it. Elevated liver enzymes. We can see swollen lymph nodes because valley fever is a systemic infection. It's throughout the body. So the body's going to respond by activating that immune system. So you can see swollen lymph nodes anywhere. If it goes to the spine, you'll see back or neck pain, and maybe even paralysis. These are not rare things that happen. These are actually common things that happen. If it goes to the brain, like we talked about, Poppy, it causes seizures, causes vestibular disease, and it causes encephalitis or stupor, where they're just not there. Encephalitis is an inflammation of the brain. If it goes to the skin, it causes abscess-like skin swellings or non-healing oozing sores. These are this is the form that's zoonotic, meaning it's infectious to other animals and people. And this is not talked about in human medicine. But this is actually how I got it the second time, is from my dog with the draining lesion. And I was kind of cavalier about everything because I was like, oh, I had it before, I'm immune for life. Yeah, no, you're not. And there have been some cases recently in Arizona, and one of them was a dog with those sores between the toes, the interdigital furunculosis. And this dog was misdiagnosed with allergies, and those sores ended up being valley fever sores. Yeah. And I have not seen that. One of my colleagues saw that just a few weeks ago. So I was like, holy cow. And that's infectious. Scary stuff. So it's not only serious, it can be scary. Valley fever can go to the eyes. It has gone to testicles before. I've seen cases like that. And then another place that it goes is the heart. And one of the first signs that it's gone to the heart is an arrhythmia, so an abnormal heartbeat. So that's something that you need to have looked into if a dog has something different about their heart rate or heartbeat. And then with valley fever of the heart, it can progress to a pericardial effusion, where you get fluid around the heart within that pericardial sac. And if that's not caught and treated, it leads to heart failure because it squeezes the heart with all that fluid around the pericardium. And valley fever can cause sudden death, and usually the cases of sudden death are because of valley fever that's gone to the heart, that we didn't realize, and it causes heart failure. So crazy stuff. So what makes valley fever tricky to diagnose? Besides the fact that the medical community is just not informed and not aware of it, especially in non-endemic locations, we saw there was a long list of symptoms, really can do anything. The symptoms are non-specific, they're general and vague, they're flu-like. When you first get valley fever, it's just flu-like symptoms. And they can be actually pretty mild, and they can skip that flu-like stage and you don't realize your dog had that, and then it goes to the bones or the joints or the brain, and you didn't know that there was even an issue till it becomes severe. Valley fever is also similar to other diseases because we have all these bizarre symptoms that look like other diseases, whether it's elevated liver enzymes that just look like a liver disease, or elevated kidney enzymes when we have inflammation of the kidneys. So it looks like other things. So sometimes when people are not aware of it, or physicians or veterinarians are not aware of it, they're not testing for it. And then the frustrating issue is valley fever tests are unreliable. So we see a lot of false negative tests. And that means that a dog has valley fever, but the blood test is negative. And so you have to look at other things. You have to look at symptoms and where they live and the other lab work to try to figure it out. All right, so let's look at some diseases that valley fever mimics. So valley fever mimics kennel cough all the time. And this is a common problem that allows valley fever to then disseminate, because early cases of valley fever look like kennel cough. Their symptoms are the same: coughing, lethargy, fever, lack of appetite, and they both can lead to pneumonia. So this commonly gets misdiagnosed. So a dog with kennel cough that comes in the Western United States, or a dog that has visited the Western United States that all of a sudden gets kennel cough, needs to be checked for valley fever. So this is what happened to me: bacterial pneumonia. Fungal pneumonia or valley fever pneumonia will look just like a bacterial pneumonia. In fact, the x-ray can look the same too. So you can't really go with the x-ray findings. So a bacterial pneumonia, same symptoms, and actually pretty vague too. You know, lethargy, lack of appetite, coughing, fever. Both fungal pneumonia and bacterial pneumonia do that. And this x-ray is a dog on their side again, with the head over to the left way over here and the trachea coming down. And you see that white pneumonia kind of in the same place we saw it on the valley fever dog on that x-ray. So very confusing. And, you know, when it's not diagnosed properly, it delays treatment and gets worse and worse. So valley fever will also mimic arthritis. And this is a common one we see in Arizona, especially when an old dog with their immune system that's not as great as it used to be gets painful and starts limping, is stiff. And if it's an old dog, the vets are like, oh, he's just got arthritis, and they don't think to test for valley fever. But valley fever causes the same kind of symptoms. And this is what happened with Spencer. So Spencer is a 15-year-old neutered male pug mix that had a 2 to 3 year history of mobility issues. Difficulty walking, stiff and sore. And about the 2 months before I saw him, he started being really lethargic and panting like crazy, and had neck pain and right front leg pain. And he came in to see me for arthritis because she went to the vet and they said, oh, he's just an old dog. He's got arthritis. Here's some drugs. And she was smart enough and she's like, I don't want to put him on drugs. So she came to me for holistic treatment, basically acupuncture and chiropractic, and herbs for arthritis. And when I saw him, he had such horrible neck pain. He was all scrunched up and his shoulders were like at his ears, and he couldn't even move his head because his neck hurt so bad. And his right front leg, he'd limp on it. And we'll see that with cervical or neck IVDD, the intervertebral disc disease in the neck, where they have a prolapsed disc and it causes neck pain. And then a root signature is where they limp on a front leg because of the nerve pinching on one side. So he really looked like he had a disc that was prolapsed in his neck. And so I treated him for that and arthritis, and he got better. But usually these dogs with disc problems in their neck get better after 3 treatments. And on the 3rd treatment for acupuncture, he was better, but he wasn't great. And I was like, there's got to be something else. So I sent her back to her vet for a valley fever test. And her vet said that was a waste of money because he was just an old dog with arthritis and you know, he doesn't have valley fever. And she persisted and got her vet to do a valley fever test, and it was positive. And everyone was surprised. So she treated him with fluconazole, which is the antifungal for valley fever. And then we modified his herbs and modified a few other things, knowing that he had valley fever. And then his mom said a very short 3 months later, Spencer is a completely different dog. He is no longer panting. He's running around and playing, bullying his bigger siblings, and is a very happy, curious dog again. When people see him, they tell me they can't believe he will be 15 in January and think he is a 9 or 10-year-old dog. I honestly never.
I have to say that is amazing. Yeah. And I have to tell you that pug Boston Terrier mix should be a national breed. That is adorable. Should be a Boston pug.
Yep. Spencer is a great dog. He's like the sweetest dog in the world, but he's doing great now. He's still going strong. So, you know, these arthritic dogs, don't let them fool you. We need to be checking. So valley fever commonly affects the hip joints of dogs and can be mistaken for hip dysplasia. So unless a vet knows to look for it and test for it, we get these dogs that are painful and limping and, you know, have trouble with their back end, and everyone's like, oh, it's hip dysplasia. So this is actually a x-ray of a dog with hip dysplasia. And this is the pelvis and the hips and the legs coming down, and his head would be way up off the screen. But with hip dysplasia, the hips do not sit in the acetabulum or the socket securely. So a normal hip should sit about at least 50% in the hip socket. So the ball joint is kind of floating out a little bit too far. So it's loosey-goosey, and that's what hip dysplasia is. So this is Captain. And Captain is an 11-year-old neutered male golden doodle that was diagnosed at 11 years of age with hip dysplasia, which is actually a little late in the game for a diagnosis, although sometimes that happens when the hip dysplasia leads to arthritis in the hips, and then you finally see the symptoms. But Captain came to me for acupuncture for hip pain. And I acupunctured him. He got better, but he didn't get perfect. And And then one visit, he came in and he was in such excruciating pain, I couldn't even touch him. And I was like, this is not normal. You know, when they're getting better with some kind of chronic pain, they usually continue to slowly get better, but he like got worse and like really worse. And so I sent her back to her vet and I said, have them run a valley fever test. And they did. And he was positive. And I also got a hold of his x-rays and finally took a look at his original x-rays that said he had hip dysplasia, and the hips looked fine. Like they didn't look like that x-ray. So I was like, what the heck? I mean, they just wanted to hang this diagnosis on him and didn't even look. So now let's see. Captain's mom says now he acts like a puppy again and is in better health than he has ever been. Woohoo! And all we had to do was, you know, add some fluconazole, change the herbs, continue the acupuncture and chiropractic, diet therapy, that kind of thing. And he's doing fabulous. This is a scary one with people and pets. This happens in people too. Cancer gets misdiagnosed. So you can get a cancer diagnosis and it's not really cancer, it's really valley fever. And it happens with lung masses that are diagnosed as lung cancer when they're really valley fever granulomas. And this x-ray is, we'll look at the one on the right because we've seen this position before, where you've got the chest of a dog and the trachea coming down, and you can see the heart on this guy. But the arrows are showing this round area, this white lesion. And that could be cancer or it could be valley fever. They look the same.
So it looks like a fungal ball, basically.
Yeah.
I wonder how many, do you know how many dogs are actually misdiagnosed as cancer that's actually something else?
We don't know, but I see them a lot. It's also misdiagnosed as brain cancer, or lymphoma if they have swollen lymph nodes. Or
that's what I was wondering. I was absolutely wondering about lymphoma actually just being a immune response to fungal.
Yep, it can. Or osteosarcoma. That can be misdiagnosed unless someone is doing advanced testing. Or cancer in the eyes because it causes inflammation in the eyes. Yeah. So this is Kit. Kit is a 6-year-old spayed female Shiba Inu with masses in her lungs. She had several masses that looked like that x-ray, but several of them. I think there were 3 of them. And she was diagnosed with lung cancer off an MRI. And they never considered fungal, even though she lived in Arizona. And that's because the radiologist that read the MRI is on the East Coast. Happens all the time. They don't even think fungal.
You know, everybody sends their x-rays out now to be read. And
yeah,
I have a really big problem with that.
Yeah. So we need to think about these things, you know, and not just, I mean, people will take that radiology report because it's a specialist that read it, and that's the Bible. And that's what happened with this dog. And she came to me for cancer treatment. And she came in and she was so painful that she couldn't even take a breath. She had these tiny little breaths because she was too painful to breathe. And I don't usually see cancer, like lung cancer, causing that level of pain, but I see valley fever causing that level of pain. And interestingly enough, she had had a valley fever test, but it was negative. And they had even gone so far as to do a trial course of fluconazole, which is what we commonly do here if we're unsure we'll do a 1 month course of fluconazole, which is an antifungal for valley fever. And if they respond positively, we're like, okay, maybe it's valley fever. But they felt like she didn't respond, but that's probably because it was really severe. So I told her, I was like, I think this is valley fever. And fortunately, the holistic treatment for valley fever and cancer is very similar because it's phlegm stagnation in Chinese medicine. So both of them are treated the same. So I kind of treated both of them, but heavy on the valley fever kind of stuff. And she got better. And she got better fast. And then I finally got her to retest the valley fever test, because normally what you do when you trial treat is you treat them for a month and then you retest the valley fever test. And they never did that because it can turn positive once you start treating it, and because it mobilizes the fungus and then the body sees it. And so I finally got her to get another valley fever test and it was positive. And then she had x-rays done and those masses in the lungs started shrinking and they shrunk down to nothing.
That is so amazing.
Yeah.
I'm so excited to hear about this.
Let's see. Let me see what Kit's mom said. After one session of acupuncture, I saw a positive change. Combined with Oriental medicine tinctures, I saw continual improvement. It felt like a miracle to see Kit recover. Today, Kit's 9 years old, healthy and thriving, and is doing very well. There hasn't been a reoccurrence of her valley fever. So she had 3 big masses in her lungs that shrunk to nothing when treated appropriately. And this is a dog that had originally a cancer diagnosis. Happens in people. Frustrating stuff. All right, so how is valley fever diagnosed? I kind of alluded to the valley fever test called a Coxie titer. And it's a titer is a measurement of antibodies to whatever organism you're looking for. So we test for the valley fever antibodies that the body produces. And it's kind of like a vaccine titer where you're testing for like rabies antibodies, or a distemper titer when you're testing for distemper antibodies. So that's the most common test for valley fever and sometimes the only test that people do.
Dr. Pamela, is when you do a Coxie titer, are they checking for other molds and fungus and yeast?
No,
just that.
That's just valley fever. So there's a fungal PCR that tests for all the fungal infections. And so I'll do that in some cases where it really looks fungal, but valley fever keeps coming up negative. And I actually had a dog with a bone lesion that looked like bone cancer. And they got as far as biopsying it. And it ended up being aspergillosis, which is another fungal infection.
That's exactly why I was asking.
Yeah, and had they done the fungal PCR that checks for that, they may have prevented having to do a bone biopsy, because there are non-invasive tests that you can do. Yeah, so that happens. So you have other fungal infections that can cause very similar symptoms. And really, the treatment is similar too for all the fungal infections. So the other thing we do is a complete blood count. So we want to look at the blood cells, the red blood cells, white blood cells, platelets. We want to look at a chemistry panel, liver enzymes, kidney enzymes, electrolytes, proteins, glucose, because that's going to help us, especially if the titer comes back negative. We want to be looking for other things that could give us a clue that it's valley fever. And a T4 or a thyroid screening test is good to do, because valley fever will normally suppress the thyroid because it's a chronic disease. And then I always like to do a heartworm 40X, because heartworm disease will look like valley fever with the coughing. And the 40X part is the tick-borne diseases like tick fever and Lyme, which will also look like valley fever because they have very similar symptoms. So this is just a nice baseline group of tests to narrow things down. And then advanced testing. So, you know, if the dog has more advanced disease, you may want to do a urinalysis, and that checks kidney function. And then there's a respiratory PCR that a lot of times I'll recommend right off the bat when they have the kennel cough kind of signs, because the respiratory PCR test is a blood test that checks for kennel cough, distemper, influenza, and a bunch of other viral respiratory infections. And that way you know if it's one of those versus valley fever. And then x-rays are commonly done. So chest x-rays, joint x-rays, bone x-rays to get more information. An MRI or CT scan is normally done with brain issues like the seizures or back issues like paralysis. And like Kit, she had a whole body MRI and they found the cancer, which was valley fever in the lungs. And then with an MRI or CT scan, that requires an anesthetic, and they'll usually do a CSF tap at the same time, which is a cerebral spinal fluid tap, and they'll look for the valley fever in the fluid. And then sometimes a biopsy is done, and that, like a bone biopsy we talked about, or a biopsy of a lung mass, or even like a lymph node biopsy if you've got big lymph nodes, because you can see valley fever sometimes on those biopsies. So luckily, I've partnered with a lab that gets you access to a comprehensive test that basically does all that baseline lab work that I recommend with the valley fever testing. And they come to your house. So it's a house call kind of thing. And you can check it out at caninevalleyfevertest.com. They're in most metro areas, not all, but most of them. And then let's go over a little bit about treatment. So, you know, if you want more specific information, follow me on Instagram at Holistic Vet Consults and DM me, because no dog is the same with valley fever. And I'm happy to talk to you because you're a member of this wonderful community. All right, so let's get back to that model. So we want to, there are those 3 areas that we need to focus on so we can get dogs relief from valley fever. We can get them symptom relief, relieve the pain, get them eating again, get their energy level back up. And we talked about education. So educating pet lovers, the general public, the medical community. And we talked about the symptoms, like sorting out the symptoms and the variations of valley fever, because there's tons. And they can be confusing, and valley fever mimics other diseases. So we need to be aware of all the possibilities that valley fever can look like. And then we want to know about testing. And I go more over, you know, how to interpret tests and what to look for as far as abnormalities on some of these panels. That would clue you into valley fever. So knowing that's really going to help you. And then the next thing we want to do is equip pet parents with tools to help their dog recover from valley fever. So I go over drugs and supplements. There are only about a half a dozen drugs for valley fever. There are not many, and there's not a lot of research because, you know, they don't feel like valley fever is that important. So they're not researching a lot of stuff. And they're, with the drugs for valley fever, some of them are better for some forms of valley fever, like with the pneumonia, and others are better for other forms, like if it's in the bone or the joint, you would pick a different one. So it really depends on the type of valley fever with how you pick the drugs. And then
Dr. Pamela,
supplements. What's that?
is the antifungals hard on them?
Mhm. Absolutely. They have tons of side effects. They affect the liver, they affect the kidney, they cause lack of appetite, they cause hair loss, they cause rashes. Yeah, they can be rough. And when you see side effects, the first thing a conventional vet wants to do is just upgrade to another antifungal, which has the same kind of risks. And yeah, it's rough. And like with Kit had tried the fluconazole and had some reactions to it, so she didn't want to do fluconazole again. So we actually got those lumps to go away in her lungs without antifungal drugs. We got it done just with herbs, supplements, acupuncture, and diet therapy. Yeah. So yeah, the drugs are rough, and people need to know about the side effects. And sometimes vets don't realize that a pet is having a side effect when they're getting rashes. That's a tough one because fluconazole causes rashes all over the body or anywhere, and that gets missed. So they just treat with antibiotics on top of the antifungals and keep going.
That's so crazy. I actually took an antifungal once and it gave me fibromyalgia like symptoms.
Yeah. Yeah. So there are tons of supplements. So there are herbs, there's homeopathics. We want to stimulate the immune system. You can use mushrooms, and it really depends on the individual patient what you use, and like which mushrooms you use, because some of them are better for the brain and some are better for the lungs.
I think it's interesting that you're treating a fungus with a fungus.
Mm-hmm. Yeah.
That's so wild.
Yeah, it works because I mean you're stimulating the body's natural healing and bringing it back into homeostasis. And if a mushroom works, fabulous. I mean it's food, but it's medicinal food. So and speaking of food, we definitely want to do a healing diet. So that's super important because the immune system, 70 to 80% of the immune system is in the gut. So what you feed your dog makes a huge difference on their immune system. So if they have the immune capacity to even help themselves heal. So diet is huge. And basically a healing diet, the basic is a fresh food diet, staying away from kibble and canned, which cause inflammation.
Now, would you consider doing like a low mast cell, like a low histamine diet, or would you do something because of the fungal is less moisture or less warmth or anything?
No, because it's systemic. Yeah. And then you can tailor the food to the dog's symptoms. Like you may want to do a cooling diet because valley fever causes a lot of heat. So you may want to do a cooling diet, but not all dogs have a lot of heat, especially if it's been going on a long time. They may be the opposite. So I tailor more on energetics than I do the actual fungus. But there are antifungal kind of foods. So you can actually add things like kiwi and peaches. And I actually have a whole list of foods that are that are chitinase containing, that break up the chitin of the valley fever fungal organism and theoretically can help with fungal infection. So I have a whole list in my canine valley fever guide for people to look at. So
yeah, and we'll share that link with everyone. You guys, I'll drop that link in the live stream when we wrap this up.
Sounds good.
I didn't, it's funny about peaches because peaches can have moldy pits, but I always do really well with peaches.
Yeah, yeah. So apparently they've got chitinases, which are fabulous for getting at funguses or getting through that fungal wall. So the other things you can do to improve immune system, or that pet parents can do to improve their pet's immune system, are the physical and manual therapies. So things like acupuncture and chiropractic. So you would send them to like a veterinarian that's certified in acupuncture or chiropractic to do that, to stimulate the immune system and help with the appetite and reduce pain and whatever symptoms they have. And then there are things like manual therapies. Maybe you can do that at home, like massage or acupressure. People can learn to do that on their pets to help their immune system or help with coughing or whatever they have. So there's so much out there to help dogs that, that's not a drug. There's more we can do. And then we need to, after we equip our pet parents with all the things, all the strategies they can do to put valley fever in their dog's past, we want to empower them to take what they've learned and put it into an action plan. How to change their pet's diet, how to give medications, how to hide medications, or how to prioritize medications if the dog is not going to take a whole lot, because some dogs won't tolerate a whole lot of stuff. And then medicating tips, we need to help pet parents know how to give the medication, either in little pill pockets, or how to pill them or mix them in liquids or whatever. There's all kinds of tricks that we know that can help pet parents do what they need to do to help their pet. And I think one of the important things is teaching pet parents how to advocate for their pet and how to collaborate with the vet and how to put a medical team together, because your pet is going to need a lot of people to help you. And the pet coaches are part of that team, the vet techs. Maybe you have a pet sitter that's on the team. Or the specialists. There's lots of people on the team, and you need to know how to advocate for your pet. And when I teach people about valley fever and give them all the strategies they have, they can advocate them, because sometimes they know more than whoever they're talking to about it. All right, so we're going to wrap it up. So basically, valley fever is bizarre. It doesn't follow any rules. It goes wherever it wants in the body. It's more common than you realize. So it's considered an orphan disease, but now it's becoming a superbug due to climate change. It's super difficult to diagnose, as we saw. Gets misdiagnosed all the time because the early symptoms are vague and testing is inaccurate and it mimics other diseases. And it's tricky to treat. So we've got resistance developing to the antifungal drugs. We've got a lack of funding for new drug development. And now it's popping up in more places due to global warming. And advocating for yourself or your family members or your pets to get tested and treated will ensure a successful outcome. And thank you. You can follow me on Instagram at Holistic Vet Consults. And then we'll put the link to the Canine Valley Fever Guide, which is basically Canine, the letter K, the number 9, valleyfeverguide.com, with tons of information for you.
That was awesome. Thank you so much. There's a couple of questions.
Oh, good.
Gina Denai wants to know, does valley fever that looks like lung cancer, does it grow? But it must grow.
Yes. Yes. It gets bigger, but so does cancer, right?
Right.
Yeah. So it's still confusing. So you can have the lesions in the lung are actually just like scar tissue around the fungus. It's not like the endospores and stuff that we looked at on the valley fever life cycle, because that's more microscopic. These are actually clumps of the fungus surrounded by scar tissue that form granulomas.
That's
And
interesting.
yes, they get bigger, but they also get smaller. And cancer doesn't normally get smaller, unless you're with a holistic vet, and then maybe it can. But
And do you diagnose horses the same way?
yes, although you can do the valley fever titer on a horse, and you can probably do the same basic foundational lab work on a horse. I don't have a lot of experience in horses, and they don't get it as much as dogs do. As far as our domestic animals, dogs get it the most.
And what about cats? Do you see cats often with it?
No. So cats can get it. We don't see them with it as often. And when they have it, it's usually the skin problems where you get the draining lesions on the skin, or I've seen it in the bones of cats. But we don't usually see the respiratory one in cats. Or maybe it just gets missed. Maybe they just thought it was an upper respiratory infection and blew it off. But yeah,
Right.
we don't see as many cats, and it may be because most cats are not outside as much as dogs.
Oh, you've got a point there. I never even
Yeah.
thought about that
Yeah.
because I have a barn cat.
Yeah. So
So,
that one would be at risk. But yeah, we don't see it a whole lot in kitty cats.
Charlene, do you want to ask your question or do you want me to read it? Go ahead and unmute if you want. So since it mimics so many other diseases, it seems like it should be an automatic first check.
Absolutely.
Yeah.
Yeah. In endemic areas, it should be. And a lot of vets do that. Like that's what I did when I was in conventional medicine. When I did blood work, there was always a valley fever on it, no matter what. We always need to be looking for it. But like, in the eastern half of the United States, nobody looks for it.
So my mom died of mucor.
Mm.
And it had gone from her lungs to her brain and eventually killed her. And I can't believe that they couldn't stop that. So watching your presentation, it was bringing back all of that
Oh my
memory.
gosh.
And she kept getting pneumonia, and I kept talking to the doctors saying there's got to be a fungus in there. You guys, every time she goes to the hospital, she gets better, comes home, gets sick. And I begged them to run a fungal test. They did an aspergillus test and it came back high, but they really didn't address it, which I was pretty frustrated about. And
Yeah.
it eventually was her demise.
Yeah. But that's sad. And that actually does happen to a lot of people. And I've tried to get into the People Valley Fever Facebook groups, but I don't get a lot of positive responses because I'm like, hey, I'm a holistic vet and I've had valley fever and I treat valley fever. And if you guys have any questions, and they're like not open to the holistic stuff. And I'm like, this stuff can save your life.
So do you use like N-acetylcysteine and black seed oil, grapefruit seed extract? What are the herbal remedies that you would use in your tool chest for this?
So you want to use antifungal herbs, like Artemisia would be a nice one. And you want to use immune stimulating herbs like ginseng and astragalus. And then, it just depends on the dog's symptoms with what you use, or the people. I actually have a valley fever tincture that I make that has antifungal, anti-inflammatory, immune stimulating, pain relieving, and anti-cough herbs in it. And it works fabulous. That's one of the things I use on all my dogs with valley fever. And
Assume that there's some berberine there.
yep, berberine is antimicrobial and antifungal. Yes, you use berberine containing herbs.
And
Absolutely.
and oregano.
Mhm.
I would think that you need that but to kill
Yep.
the
Oh, there's dozens of herbs you could use depending on, what you have available.
So once you resolve this issue, do you ever really resolve it? There has been thought that you can never get rid of it, but I believe that I got cured from it. And you think that you got cured from
Yep.
it.
Yeah. So I think that dogs and people can be cured because the people that are saying it can't be cured are not using holistic strategies. They're using antifungal drugs and that's it. And you probably can't be cured if you're just using antifungal drugs, right? If
Yeah.
you're not supporting your own immune system or the pet's immune system and getting their immune system able to fight it. So yeah, I think we can resolve it in people and pets.
I agree. I agree 100%. I did acupressure and antifungal herbs, as well as probably NAC and quercetin. That
Yep,
yeah, and
which improve the immune system. So you always want to do something immune stimulating. And there's lots of stuff out there to do it.
yeah. Any other questions, you guys? This is so fascinating, and all my California, Arizona, kind of the up to mid Texas. So even those of you who live on West Texas side should really think about this. Absolutely. And I guess that is a side effect of the weather change. It's weird because it doesn't seem like people will call it global warming initially, and it didn't seem like it was always getting warm. It just seemed like it was a little bipolar. Like the weather was more extreme hot and cold. So I just felt like it was such a wrong term, but our weather is more extreme. Yeah.
Yep. So it's definitely spreading. And just because we're so mobile, people don't stay where they live. They travel. They go to Mexico. You can get exposed there. You go on vacation and you get exposed and then you can get it and not realize it.
Yeah, and I remember doing some research on valley fever years ago, and they found like ancient men with valley fever in their mummified bodies. And I was shocked by that. So I'm assuming like people in Egypt can get this.
Yep. Oh, I'm sure. I mean, it's the fungal organisms are ancient, and they're very hardy little things.
I actually, when I went to Egypt, I paid some guy off to open some tombs. And I got tomb raider's disease from it. Serves me right. Yeah.
Dang.
So progenitor. And that was a rough go. I was very sorry that I did that. It's not smart. You guys never go to Egypt and pay people to open a tomb for you. Yeah.
Someone asked if I do telehealth. Yes.
Isn't that wonderful that vets can do that now?
Yes. And we talk about herbs and supplement and diet. I do telehealth consultations all the time and specific consultations for valley fever. And I actually have a strategy session that you can get, like a free strategy session, just to see if I'm the right fit for you. And if you go to holisticvethelp.com, you can schedule a free strategy session and we'll go over all the things that I can help you with.
Holisticvethelp.com.
Help, H-E-L-P.
Okay.
Holisticvethelp.com. And then if you go on my website, drpameladragos.com, you'll find the telehealth consultations.
Okay.
But yeah, I help people around the world with chronic issues with their pets.
Amazing. Thank you for your time. I'm wondering about horses with heaves. I have a little pony out here that seems to be allergic to shavings, and now I'm wondering if it's actually a shavings allergy, because sometimes just walking up a hill, she's puffing, and I'm like, maybe it's not a
Yeah.
shavings allergy.
Yeah. So
Yeah.
if you talk to a holistic vet that specializes in equine herbal medicine, there are herbs for your respiratory problems.
I have Ellie campaign and mullein, and I've used triphala, fenugreek, stuff like that. So I can definitely pull something together. I do custom blends for horses. I actually work on a lot
Nice.
of EPM, and I have an
Yeah.
EPM mix. So no herbal veterinarians and equine around here at all. It's very rudimentary. It's very behind, and I'm just sad because I'm wondering how many animals actually were diagnosed with cancers or pneumonia or any sort of respiratory issue, and it's actually fungus.
Yep. A lot.
Yeah.
A lot.
Thank
Yep.
you for your time today. This was
You're
really
welcome,
valuable
Poppy.
information, and I hope that we can spread the word.
Thank you. I appreciate your help spreading the word.
My pleasure. I have this hatred towards fungus since it killed my mom.
Yeah.
Yeah,
I don't blame you. Yeah, it's rough.
it is. It's horrible. Okay, you guys, Kim says very informative. So yeah, all you holistic pet coaches, we need to know this stuff. We
Yep.
need to
Get it
think
on your
outside
radar.
of the box. I'll probably post this video I have another platform called the Cancer Free Canine, and I think I'll post this
Oh, that would be
too.
good.
Yeah, because
Yeah.
I really feel like we are so quick to jump to a cancer diagnosis. It's just an easy.
Yep. If you have an old patient, they got cancer, right?
Yep. Yeah, and I get a lot of calls for that, and I'll be like, "What type?" And they're like, "Oh, we didn't test because my dog is old." So we're just taking it like it is. And so I understand that, but still, it might not be that.
Right. It might be something totally treatable.
Exactly.
Yeah. Need to find out.
Well, bless you, Dr. Pamela. Thank you for your time today. This was a sobering, informative thing.
Good. I'm glad it helped. Thank you, Poppy.
Have a great time. Have a good week. You guys, I'm going to the Feed Real conference in San Diego. Hopefully I'll see some of you there. If you are going out that way, of course, stop by and say hi, give me a hug. And then we'll have our animal iridology session. I was thinking about that. Actually, Dr. Pamela I'm wondering if we can track the fungal infections in the iris marks. So as you were teaching about that, I was like, oh, we need to take some iridology photos of these valley fever dogs. We are tracking neurologic disorders right now. And
nice.
I'm doing a study of iris marks in EPM and Lyme infected horses, and there's some consistencies. So, yeah, hopefully I get to publish that through either Colorado State or UC Davis. UC Davis actually asked me to go take photos of some of their mules in a EPM study.
Nice.
Yeah.
That's interesting.
Isn't that cool?
Using non-invasive ways to diagnose, or at least get a clue that may be going on.
Yeah, so retina scans are predetermining your chances for Alzheimer's, or at least cognitive dysfunction, ahead of the actual physical manifestation. And they're training AI to do that on retina scans. So,
oh, wow.
Yeah, I think we're ahead of the curve. Everybody's vilified iridology as such a pseudoscience, but we're seeing it as an up and coming, legit, at home, user friendly. The better our cell phones get, the more you can do it at home.
Well, and it's a microsystem, just like, palm reading and ear acupuncture. There's all microsystems throughout the body. It's just another microsystem that you can evaluate.
Exactly. The body's a complex, beautiful
Mhm.
thing.
It is.
Take care, you guys. Have a great week. And
Thanks,
hopefully I'll
Poppy.
see you in San Diego, and Dr. Dragos, hopefully we'll meet each other in person.
Yeah, fabulous.
And you guys don't forget that botanical webinar or summit online that you guys can all go to. I will be at an equine dissection that day, so I won't be available. We take eye photos and then go through a dissection to confirm the iris marks.
Cool.
Yeah. Okay. Have a great week, you guys. Bye.
Okay. Bye.